So we wanted to talk about vitamin K. It's one of those things that happens when the baby is born. It can be given when babies are born at home, but also in the hospital. And we wanted to talk a little bit about why it's needed. So one of the most important things to know is that when babies are born, their gut is still not very mature, and it's almost considered sterile, not quite, but it doesn't have enough of the good, healthy bacteria to make enough vitamin K. And vitamin K is part of our clotting cascade, and we need enough vitamin K to not have bleeding happen. And so babies can have this disease called the hemorrhagic disease of newborns, and so this is why we give vitamin K in order to prevent that.
That's exactly right. And who knew that it was our bacteria that were making most of our vitamin K for our bodies? So, and you know, I had this experience in my training program where I saw several children with hemorrhagic disease of the newborn, one as old as 4 months old. Usually it's within the first couple of weeks of life, and it's devastating. There's either internal bleeding half the time, or there's external bleeding where you actually know it's happening. And either one, the children bleed and bleed, and sometimes you don't know it's happening at all, so they get very sick before they get to the hospital. So it's something that as pediatricians, of course, we always want to try and help prevent. But there are a couple of ways if you want to look at how can I help and give the vitamin K shot, or maybe you don't want to give a shot to your baby. What do? You don't have to just choose not to do it at all, because you want to protect your baby. So
right. Yeah. So vitamin K, you know, the bleeding disorder that can happen is not common, but it is when it does happen, and if heaven forbid should it happen to your child, it is just devastating. So my experience was a little bit different than Dr. Miles's. I had a baby in my practice who was actually just oozing from her gums, and we knew that that was related to this bleeding, and we were able to catch it early. She went to the ER, got the vitamin K injection, and everything was well. And that's not the case. Oftentimes it can be quite a devastating event. But as we were saying, there are a couple of options. You do not have to do all or nothing. There's the injection, and one of the most important things is to know what type of vitamin K. There are two types of vitamin K. There's vitamin K1 and there's vitamin K2. Vitamin K1 is the one you want for what we're talking about, to prevent the bleeding problems that can occur in newborns. Vitamin K2 is really important for cardiovascular health and bone health, and vitamin K1 is part of this clotting cascade, and there are two ways that we can do this.
That's right. So there's the shot that generally is given in a hospital, and also midwives, even home birth midwives have, and that's one injection, one and done. And the rate that's going to help prevent hemorrhagic disease in a newborn is 99%. The other way is with vitamin K drops. We have a specific kind that we'll recommend to you. We'll have that down in the comments. And that is drops that's just K1, and it's by Biotics Research. And the problem is you have to stay attentive, because you have to give it once a week for 10 to 12 weeks. So you get 2 drops first, and the first dose you get, and you do that immediately as fast as you can within the first couple of days of life, hopefully. And then you do once a week, 1 drop for the rest of the weeks. So it's a lot more of a commitment, and it only is 92% effective at preventing hemorrhagic disease in the newborn. It doesn't sound that much different, but if you're one of those percent and your baby gets this because it didn't work, it's 100% for you.
So long and short of it is that we recommend vitamin K. If you don't want to do the injection, please consider doing the drops. But the vitamin K is incredibly effective in preventing the bleeding disorder that happens in babies.
That's right.
So please do it.
Yes.